Hello, and welcome to Prairie Pulse. Coming up on today's show, we're going to have via remote webcam from Sanford Health, Dr. Avish Nagpal. Dr. Nagpal, thanks so much for joining us today.
Thank you for having me here.
You are the infectious disease specialist at Sanford Health. Tell us, before we start on what that is, tell us a little bit about yourself and your background.
Sure. I'm an infectious disease physician at Sanford Health, and I'm also the medical director for infection prevention and control. I've been with Sanford since 2013. I was born and brought up in India and did my medical school and internship over there. Worked a couple of years, saw a lot of infections that got me interested in pursuing infectious disease as a career. And so in order to pursue higher education, I moved here, did public health, master's in public health in Bowling Green, Kentucky, and then came to Fargo to do my residency through University of North Dakota. I actually did my residency here with Sanford. It was MeritCare at that time. And following that, I did a fellowship in infectious disease at Mayo Clinic. And after that, I came back and I've been with Sanford ever since.
All right, sir. Well, we're here today, of course, to talk about COVID-19, the coronavirus. And, can you tell us your analysis of what the virus is, maybe in layman's terms, for our viewers and listeners?
Yeah, absolutely. So this is a respiratory virus. It belongs to the same family as the viruses which cause common cold. It's obviously a lot more transmissible and a lot more pathogenic, which means that it causes a more severe illness as compared to common cold. And it's because it's a respiratory virus, it's primarily transmitted through respiratory droplets, respiratory secretions, or close personal contact with somebody who has COVID. Not a new family of viruses, but definitely a new virus in that family, and with the features that are significantly different from other members of this virus family.
Well, yes, sir. And of course, as we're recording this interview, of course, in the U.S., there have been around 70,000, of course, deaths with this. And can you talk some about how what it's like and when you get it, and how contagious is it, and how, I guess, what's the death rate of it? Or do you know yet? Do we know yet?
Yeah, so we don't have all the answers, but we have a lot more answers now as compared to a few months ago when all this started. So the illness it causes really can range from just mild sniffles to a full-blown pneumonia, which requires you to go to the intensive care unit and get, in some cases, need ventilatory support to help you breathe. But most of the cases, 80% of them are usually mild and don't require much medical attention. You can manage at home and be okay in a few days. There is a certain subset of patients who go on to develop a more severe respiratory illness, typically a pneumonia, and that makes them end up in the hospital. Even in that subset, most of the patients do okay. They are in a hospital for a few days. They need supplemental oxygen through a nasal cannula, some IV fluids, some nutritional support, fever-reducing medications, cough-reducing medications, things like that, and then they do okay. But a small percentage of patients do go on to develop a very severe pneumonia, something that we call ARDS, acute respiratory distress syndrome, which means that the infection or inflammation in the lung is so out of control that you can't breathe on your own, and you typically need to be hooked onto a ventilator to help you breathe. So that's the most severe form of it. And a good proportion of those patients who go on to develop that kind of illness do succumb to their illness. What we think is that about 2 to 4% of people who develop some symptoms succumb to the illness. But now we are discovering that there is another subset of patients who may get the infection, but they have never they never go on to develop any kind of symptoms. So if you look at the death rate from known infection, it's probably 2 to 4%. But if you take into account these hidden infections that might occur in people who never manifest any kind of symptoms, then the death rate overall from the infection comes low to less than 1%, which is kind of good because that means the infection is not as lethal as we initially thought it is, but bad because then you cannot isolate people who have the infection, and that poses a challenge to containment of the infection as we are seeing. And we think that is contributing to uncontrolled spread, or at least our inability to get it under quick control so far.
Well, with that said, has the shelter in place, the social distancing, of course, types of measures that we've done in this country, have they been beneficial for the most part?
Oh yeah, absolutely, no doubt about that. You look at what happened in Seattle, and you look at what happened in New York. They just got slammed with the large number of infections in a very short time without any significant warning, and they did, and we were lucky that we could see what was happening, and the infection had not developed a foothold in our community, so we were able to go into some sort of a lockdown and do social distancing measure, and because of that we have been able to keep the number of cases low and keep our curve flat, so to say. So if you look at the Department of Health's website, we have seen a slow and steady rise instead of just an explosion of cases in the with regards to the illness, and that's the entire outcome that we were looking for with our lockdown measures and with our social distancing, because you don't want a huge number of cases coming within a short period of time, because what happens with that is the hospital's capacity gets overwhelmed, and you kind of create an artificial lack of access to healthcare. So say we have 100 beds today and you get 300 infections, 200 people will not have room in the hospital to get on a bed and be connected to a ventilator or need oxygen support, and what effectively happens is that they don't get that oxygen support, so your death rate would be much higher if that is to happen. So yes, absolutely 100% our social distancing and our lockdown measures have helped us immensely.
Well, good. But so what has it been like for the healthcare providers, especially in North Dakota and Minnesota, in our region here, and maybe versus, say, a New York or Seattle?
Yeah, I cannot thank our health department and our political leaders for giving us, I cannot thank them enough for giving us this time and getting on this as quickly as they did. Because what it did was it bought us a lot of time where we were able to increase our hospital bed capacity. We were able to get personal protective equipment for our healthcare workers so they can provide care in a safe manner. And we were able to obtain more ventilators and increase our testing capacity quite a bit, so we could test not only maximum number of people, but maximum number of people in a very short period of time. So I'm very thankful for the time we got. We were able to keep our infection curve flat, so to say, and we were able to ramp up our operations quite a bit. And as we open up again, I feel fairly confident that we will be able to provide the care that the community deserves.
Well, that was my next question. Yeah, what do you see happening? Because we are starting to open up now. I've heard reports from some people that say we'll have to shut down again, or do you think we are moving in a slow enough manner that we'll be able to progressively reopen everything?
The situation remains fluid, but I feel fairly confident that we'll be able to handle it. As I said, we have got some time to prepare, and we used it well. And I do expect the cases to rise in the next few weeks as we open up our businesses and our economy, and we feel prepared to handle that. We can't expect everybody to live in social isolation forever. We can't really live in a bubble. So, um, so um, uh, you know, I completely understand the social pain and the economic pain that our community is feeling, as our nation and multiple countries all over the world are feeling right now. And people need to work, get back to work, get their paycheck, pay the bills. This is important. I'm thankful for the sacrifices and they have made, our community has made. These have not gone unnoticed. And even though I do see number of cases rising, but I'm thankful for the time we have had to prepare, and I think we'll be okay.
Are you a believer in herd immunity? And, well, can you tell us what that is?
Yeah, of course. So the concept of herd immunity has to do something with most of the population being immune to the infection. So say there are 100 people in a given area and 70 or 80 of them are immune to an infection, then what happens is, even if they are exposed to the virus, they don't get infected and they don't transmit the infection to people, to 20 or 30 people who are still susceptible to the virus. So even though 100% of your population is not immune, enough people are immune that the chain of transmission is broken. So, and we use this concept all the time in vaccinations. You cannot vaccinate everybody because some of the vaccines are live vaccines, and some people have immunocompromising conditions. So you can't really administer vaccine to those people. So what we try to do is vaccine everybody around them, so that even if there's an outbreak, the virus doesn't have a chance to jump from one person to another, and it has to go through multiple circles before they reach the susceptible person. So herd immunity is advantageous to a population, and that's the issue with this virus. This is a new virus. We are all susceptible. That's why you see so many infections in such a short period of time, and you see so many complications. That's not the case with influenza. A lot of the population would have seen the same strain of influenza this year or the year before or the year before, and we have a vaccine for influenza that is moderately effective. We have a pill for influenza that's moderately effective, and for this virus we have nothing. And that's why when the virus is so transmissible and so and significantly more stronger in terms of the amount of disease it causes, this is what you see, because we don't have vaccine and immunity, so it causes a lot more infections and a lot more deaths.
Yeah. Do you subscribe to the theory that warmer weather will, in fact, reduce the spread of the virus?
That is a phenomenon that we see with other respiratory viruses. I don't think we understand the dynamics very well. Maybe it's related to, schools and colleges being closed, less opportunity for people to be in closed spaces. People are spending more time outdoors. That probably leads to lesser amount of circulation in the summer months. That's true for many respiratory viruses, but as I said, this is a new virus, so we don't really know how it will behave over the summer months. If our assumption with transmission dynamics are correct, then we should see a decrease in transmission in the summer months, and that's what we were trying to do by social distancing to reduce the transmission. So honestly, I don't know if there will be decreased transmission during summer months. I really hope it does, because we can all we all need a break from this.
In your estimation, as a medical provider, did the U.S. drop the ball in preparing for this as it was rolling out with this new virus?
No, not necessarily. I think governments all over the world, including our country, I think they did the best they could given the circumstances and given the situation. It's a new virus, you don't know. Every virus has its own personality, so you don't know how a new virus is going to behave. And what's different about this virus as compared to other viruses is that, as I said earlier, people who have not yet developed symptoms or who do not develop symptoms can transmit the virus. And if you don't know that a person has a disease, how do you isolate? How do you recognize that person? How do you isolate that person? So I think the CDC was very aggressive up front, trying to screen everybody, trying to isolate all the recognized cases. But the virus was good at escaping our traditional public health measures, and I think when we saw things in Seattle and New York, other places acted on it as quickly as they could and imposed lockdown measures as we saw here, and that really helped us. So I think they do deserve credit for making the best out of a bad situation. Could we have done better? Hindsight is 2020. We can always do better, and I think we'll do better with the next pandemic. And I can pretty much guarantee there will be another one, because our history is full of pandemics. We have seen 3 coronavirus pandemics in the last 18 years. This is the third one, not the first one. First one that is so transmissible. But I think we'll learn from this and we'll do better next time around. But at the same time, I think we need to acknowledge what a tough situation it was, or it continues to be. And I think our governments did as good a job as they could, given the circumstances.
When do you think a widespread vaccine might be available?
Um, Again, it's hard to predict the future. Vaccine development is a very long process. It takes decades to develop a vaccine. The shortest time we have had in production of a vaccine is 4 years, and that was for Ebola. And typically it takes more than 10 years to develop a vaccine. And I know the entire world's scientific community is interested in developing a vaccine right now. And our pharmaceutical companies, our governments, they are all working overtime to make this happen. So you can accelerate a lot of process by leveraging technology, but it still takes time to address the various stages of vaccine development. You have to identify which part of the virus you can use to induce immunity. Then you have to figure out a way to introduce that particular part of the virus into the human body without actually causing the disease. Then you have to make sure that it is done safely. You are not causing more problems, more harm than good. And then you have to see whether it works in the lab. Then you have to see whether it works on a human body. And then there are bigger challenges with mass production and mass administration. So it's a challenging process to make a vaccine. And even with our best efforts, I think it would be at least another year before we get a vaccine.
Do you know, or are you involved with any of the various testing and trials that are occurring? And are there any that look promising so far?
So we are part of a couple of trials here at Sanford too, and so far what we have tried to do is repurpose some older medications to see if they work for or against coronavirus, and so far it has been disappointing. Most of these interventions have not worked. Some of them are still in trial. Some of them are mildly successful, and it just goes to show you the challenge of addressing a new bug, because as I said, every bug has its own individuality, its own personality, its own characteristics. So the tools that we have may or may not work, but what we try to do is address it on multiple fronts, just like we do with influenza. A vaccine that's moderately effective, a specific treatment that's moderately effective, supportive care, and rely on herd immunity a little bit. And that's what we are doing with coronaviruses. So we don't have a perfect magic pill, but we have different tools, and we have different interventions which put together contribute and provide incremental success in managing an individual patient and the overall pandemic in a community.
Why are cases, obviously in our region, Cass County has the largest. Is it really population? What is it that's causing the high numbers?
So I think that's the major factor that's driving the higher numbers in Cass County. But there are other factors too. You know, urban areas typically see greater transmission of the disease related to different factors, you know, increased population density, and then more people in the workforce, more essential workers who cannot stay home to continue to provide services to the community, and also higher proportion of people in the lower socioeconomic strata for whom staying home may not be possible because they may be working on an hourly basis, getting paid on an hourly basis, and may not have access to health care or may not have access to paid sick leave. And for them, you know, missing a paycheck may mean missing rent, or more importantly, failing to put food on the table. So you know, these are some problems that we see with cities and urban areas in general. So it's not surprising that Cass County is seeing most of the cases in the state, with us being the most populous center in the state.
I know hospitals in the region talk about bed space availability, and so far I understand, Sanford, you haven't had an extreme influx, so you've had beds available. Is that correct?
Yeah, so we have beds available, and we have added quite a bit of capacity at Sanford. Bed capacity, I mean, you know, we had a couple of floors, or you know, more than a couple actually, at Broadway, at the old hospital where we were not using them, or we were trying to repurpose them. We kind of accelerated that process, added a number of beds, and that helped us increase our bed capacity quite a bit. So that's one of the reasons why we feel that that we are much better prepared now as compared to, say, 6 weeks ago.
Yeah, you know, can you talk about the safety measures, I guess, that you've put in place? Well, at Sanford, because that'd be the one you're familiar with, but what are hospitals doing, restricting visitors, I guess, and such?
Yeah, so you know, restricting visitors is only one part of the equation. You know, we don't like to do that because we want our patients to be visited with their families. It's better when doctors and nurses can talk to the families and the patients face to face. So we don't really like doing that, but sometimes it becomes necessary, as in this case, to reduce traffic and increase social distancing. But there are multiple other measures that we have put into place, and these include providing a mask to all healthcare workers, asking all the patients to come in wearing a mask, using telemedicine. You know, patients who have straightforward needs like refills of their medications and things like that, and they have the option of doing video visits with their providers. You know, we have put plexiglass shields in at places of check-in and waiting rooms. We are trying to not have patients wait in the waiting areas. We try to room them as quickly as possible. We are trying to maintain social distancing. We have acquired quite a bit of personal protective equipment, so we are able to reassure our healthcare workers that they are safe and secure while they try to provide the care that our patients need. So so with these measures and some other measures, we have also implemented something called a drive-through testing, which means that if somebody is having respiratory symptoms, instead of bringing them into a hospital or clinic or an emergency room or a walk-in clinic to have them tested and risk exposure to other patients waiting in the lobby, we ask them to just go through the drive-through testing through our South University building, and that way they don't need to come in for an appointment. They can just drive up in their car, get swabbed, and the results are back usually in a day or two. And they can, if they are feeling well, they can isolate themselves at home. And if they are not feeling well, we try to admit them to the hospital directly without going through the ER or walk-in clinic.
So what is your advice for people who just go out in public if they're going to the store or to the hardware store or the grocery store?
I think that's okay. You know, grocery stores, it's essential. You know, going to a grocery store, how else are you going to feed your family? And And similarly, people are home, and if they want to do some home renovation projects, it's okay to go to a hardware store. You just have to do, common sense measures, hygiene measures, avoid overcrowding, especially in enclosed spaces. Pay attention to hand hygiene. Wear a mask. Wear a mask when you're outside. That's a simple thing that you can do to reduce your risk of infection, both getting it and transmitting it.
Some people have compared this to just being a serious flu. What's your comment to somebody who says something like that?
So, it's a respiratory virus like flu, but similarities pretty much end there. As I said earlier, flu doesn't cause outbreaks like an entire workplace, as we saw with, our meatpacking plants in South Dakota, Iowa, and our windmill manufacturing plant in Grand Forks. And with the influenza, many people have seen the influenza virus, the same strain, the previous year or the year before that. So a certain subset of population is immune to it already. We have a vaccine for influenza, we have treatment for influenza, and influenza typically doesn't cause this much respiratory failure, a need for ICU, and deaths attributable directly to influenza are relatively low. Many of the deaths that are caused due to influenza are because your risk of stroke is increased, or you get a pneumonia on top of influenza, or you get a heart attack. Whereas this virus, it's everybody is susceptible to it. We have no immunity in the population. We have no vaccine. We have no treatment, and the respiratory illness this virus causes in some subset of patients, it can progress very quickly, and it can be a very severe pneumonia. We don't see that very often with influenza. So I think besides both being respiratory viruses, the similarities pretty much end there.
Well, thank you, and thanks for joining us today.
Thank you. It's been a pleasure.
Well, that's all we have on Prairie Pulse this week. Please take care, and as always, thanks for watching.
Funded by the members of Prairie Public.